We are joined now by Tshiwela Mulondo. She's a speech therapist and also audiologist at Orel Therapy Centre. Tshiwela, you're welcome. Thank you very much for joining us.
Thank you so much.
You're welcome.
You.
And now, Tshiwela, just give us a bit of a background. Based on availability and, of course, the available data and clinical experiences, what are proportions of childhood hearing loss? I'm not sure if you can give us the statistics in Nigeria, so I'll say in Africa generally, is preventable through vaccinations, early infection treatment, or safety delivery practices?
Well, so just like you said, the World Health Organization does state that 60% of them can be prevented. This is in light of looking at the provision of vaccinations to diseases that can result in otitis media, which is ear infection. So we're looking at preventative vaccinations for mumps and measles, rubella. We're looking at preventative measures of surgeries to remove tonsils for kids that have recurrent tonsillitis and grommets. Those are the things that we need to prevent in order for us to prevent otitis media. So in cases of recurrent otitis media, this is where the otitis media is occurring much more often and therefore leaving perforations in the ear. So then that results in a conductive hearing loss.
Oh, wow.
Well, that's very interesting. I'm noting a relationship between the throat and the ear because you just said tonsillitis. How exactly is that related?
So with tonsillitis, it creates this oral fullness, what we call oral fullness. It's almost like a blockage in your ear. So then it creates moisture, which then results into the ear infection.
Oh, wow. And then in terms of development, at what exact developmental milestone should routine hearing screenings be implemented? And of course, should it be mandatory at birth, 6 months, or school entry?
Definitely at birth, because early intervention and early detection is key. This gives the child a chance in society and a chance in education as well. So early detection, meaning newborn hearing screenings that need to be done when the child is born, that to detect whether the child's inner ear is working or not. So this can be done through screenings using ABR equipments to detect whether or not there's functionality in the inner ear of the child. So we definitely need to start early. If it's late, and for those kids that are more at risk because of the medication that they're taking that might be toxic, routine checks at 6 months are definitely recommended as well.
Tshiwela, in Nigeria here, it's not something that we absolutely practice. Most parents just think he's going to be okay. You know, they don't really bother. It's not. You have a kid, you just expect there's 100. So when it comes to monitoring if or if not kids have these diseases that might lead to hearing loss, it's not on our table. But what would you suggest that parents look out for when it comes to wanting to know about the status of our kids' health when it comes to their hearing?
There are certain early signs that can be present, definitely, especially in young ones, because developmentally there are certain milestones that need to be met in terms of language, and those milestones tend to be delayed when there's hearing loss. So we are looking at, does the child respond to their name when they are called? We are looking at, is the child only depending on your actions in order for them to respond? Are they looking at your face to try and lip read what you're saying? Are they able to respond to environmental noises like a bang of the door or something falling in the house? Those are certain signs that could tell you that this child is unable to hear.
And when could it be too late to have anything done? Is it reversible when you notice on time?
On time, it's not technically reversible, but help can be made. For example, if a child does need cochlear implant, we need early detection. A cochlear implant is for kids that do not have, cannot benefit from in-ear hearing aids. So the implant is put on the head to kind of transmit the sound to the bone. So we have those things, but those things are available the earlier, the better for surgery purposes. And then we have hearing aids that can be provided for the child. If the child is detected early, it kind of gives them a push in terms of language development, developing vocabulary, later on in school, developing social skills and being able to engage with their environment in general.
Now, Barbara, I'm curious to find out if we're looking at the rural areas and the underdeveloped settlements, especially within the African region, how accessible is diagnostic audiology services available to them?
Unfortunately, the saddest part is that some parts of our African countries, including South Africa, where in rural areas, our services are still not available, especially for newborn hearing screenings. You find that in instances like South Africa, places where we'd normally have local government clinics, that facility of newborn screening will not be available. So in the rural areas, it's definitely less available than it is available in the modern areas and the middle areas. So with Africa in general, the problem stems from the lack of professionals that are actually qualified to offer hearing screenings and to do those tests, and the cost as well. The cost of the equipment, the cost of the services in general makes it a little bit more inaccessible to rural areas.
That's very interesting. Mazino, is there anything?
No, I'm very satisfied with the information that I'm getting here. I'm just very, I'm pleased that we're giving attention to this now. And I never knew until today, until during the week, that there was actually a day dedicated to hearing. It makes me wonder exactly how many people, now that we're talking about people in rural areas, how many people or kids that have actually gone without these benefits of healthcare, where they could actually have had their hearing saved. However, in Africa generally, is there a stat or statistics that shows exactly how many children have hearing loss or are prone to hearing loss?
The stats are quite high. The stats are quite high, and that results in the untreated and recurrent otitis media that happens in our society. So it's more than 65%, which is a little, which is high because it's more than 50% of untreated otitis media, and that then results in conductive hearing losses. And then you find in situations where it's in rural areas where parents are trying to self-treat the infection by putting cotton buds inside, which then worsens the infection. So in all those instances where there's limited healthcare, we are finding the stats being quite high.
Oh, wow.
You just touched on something I really wanted to know about. Is it bad to use cotton buds in your ear?
Yes.
No?
Definitely.
No, it's not.
We say no,
No,
to cotton buds.
It feels good.
It feels good. It doesn't solve the problem.
There's a nerve in there. It does feel good because there's a nerve you're innervating in there. But however, if you have earwax that's stuck there, you might actually push it closer to your tympanic membrane, and we don't want that.
Yeah, my mom's got a remedy for that. Maybe I should ask again. Now, what she would do is fill your ear up with water and just a dash of iodine. I know that must be bad. Is it?
The oil, she's in a good spot. We use sweet oil to soften the wax, and that helps the wax to actually soften up. And then once the wax is softened up, it's safer for removal, because oftentimes wax that has stayed there long enough gets dry, and now when you're trying to pull it out, it kind of pulls the skin, which hurts the skin in turn. So to prevent that, putting sweet oil or things like serum oil helps soften the wax so that it's safe for removal.
Barbara, I wanted to ask a question, because it is a World Hearing Day. So outside of just children, we live in a society and a generation where everybody has got a headphone. How does headphones, different versions, whether it's the headphone or the earphone, and the volume as well, how does this affect our hearing? Does it affect our hearing, actually?
It does. It does in the long term. Overuse of headphones does affect. There's something we call noise-induced hearing loss. So this is hearing loss due to overexposure of noise in general. So this could be through your headphones, banging noises consistently in your ears. And this can also be occupationally. Maybe you work in a factory where noise is prominent and you're not using protective hearing. Those can then result in you having the hearing loss.
So we've got one producer here. She's got a very shrill voice, and we wear these all through the show. So you're saying that this is dangerous for me now, so I'm sorry, Maeve, I have to take it. I'm not using it again.
She'll induce hearing loss.
I'm trying to save my hearing, so I'm not using this ever again. I don't know what you're saying. Is she saying anything?
She's not saying anything. Barbara, finally, before we let you go.
Usually 30 dB, which is safe. So it's not like you're listening to music, which can be higher than 30 dB.
You haven't heard this producer. You haven't heard her.
It's too loud.
She's horribly loud.
Meva is definitely coming for you after this session. Barbara, finally, let's look at next steps. Let's look at it from a primary school or government school or whatever it is that you would call it. What does implementation look like? Partnership between government schools and the government?
Yes. So partnership would look like getting the children screened when they enter into school settings, helping them to just helping that detection to be there, because we can have other things other than just auditory problems. In terms, we can have central auditory problems which are in the brain that can now discredit this child. So we need those systems to be in place, and working towards early detection and early fitting of hearing aids and cochlear implants definitely gives children a chance in scholastic settings, and having that merge from the healthcare system into the government system or into the education system will help definitely our kids to progress well in school and actually participate in school.
Well, Tshiwela, I want to say thank you very much for joining us and having this very exciting conversation with us about our ears and World Hearing Day and how we should take care of it and how kids could benefit from early detection. Thank you very much.